let's study about diphtheria. Okay, so what type of question can come on diphtheria in MRCP 1? The most important question which most often comes, which gram bacterium it is. Is it positive or negative? So remember, diphtheria, it has P, so gram positive, caused by Corynebacterium diphtheria, and pathophysiology is that it releases an exotoxin encoded by beta prophage. I always remember this by D, P and D, B. So B for beta prophage, okay? And exotoxin inhibit protein synthesis, again P. So beta prophage, positive gram positive bacteria encoded releases a exotoxin that encoded a beta, again P for prophage, and exotoxin which inhibits P for protein synthesis by encoding ADP ribosylation of elongation factor EF2. Okay, so do you remember it now? Release an exotoxin encoded by beta prophage, and exotoxin inhibits protein synthesis by catalyzing ADP ribosylation of elongation factor EF2. Remember EF2. Next, that possible presentation, diphtheria toxin commonly causes a diphtheric membrane. Most of the time it is a gray pseudomembrane caused by necrotic mucosal cells, okay, and systemic distribution may produce necrosis of myocardial, neural and renal tissue. So possible presentations are that recent visitors to Eastern Europe, Russia and Asia, and sore throat with diphtheric membrane like gray pseudomembrane on the posterior pharyngeal wall. Remember, posterior pharyngeal wall. Plus there will be bulky cervical lymphadenopathy which causes a bull neck appearance. Neuritis are cranial nerves, and heart block. Heart block is the most important complication. How we will investigate it? Terulite, agar or Loeffler's media. When we will use them? By culture of throat swab, and management will be intramuscular penicillin and diphtheria antitoxin. Let's read it from the mnemonic way. Okay, gram positive bacillus, Corynebacterium diphtheria, disease due to exotoxin, and how it was coded by beta prophage, and what the exotoxin do? Inhibit protein synthesis by EF2. What will the toxin do? Toxin will block EF2, decrease the protein synthesis and cause cell death. Throat local pseudomembrane, heart myocarditis, nerve neuropathy local. So how it will clinical features? Sore throat, low grade fever. Again remember, it is a classic important question. Number 1, bull neck. Number 2, bleeds on scraping. Gray white pseudomembrane bleeds on scraping. Next, systemic myocarditis, heart block, heart failure, arrhythmias, neuropathy like palatal paralysis, cranial palsies and renal involvement. How we will diagnose it? Throat culture swab and throat swab culture, okay, and Loeffler's medium. Always remember, and terulite agar. Always remember that clinical suspicion is key. Don't wait for the tests. Give the diphtheria antitoxin right at the clinical diagnosis. Management. Diphtheria antitoxin neutralizes circulating toxins. Give immediately before confirmation. Next is antibiotics. Which antibiotics? Penicillin and erythromycin. All right, and isolation of course. Prevention, DPT vaccines. And here is an important question: the death due to myocarditis. That's why heart block is an important point in diphtheria. And neuropathy occurs weeks later. And always give antitoxin before lab confirmation. So that's how we are covering all the important points of diphtheria.